Good evening and thanks so much for joining us this Wednesday. I'm Martha Koloski.
And I'm Mike Thompson. We want to begin with the latest numbers for COVID-19 in La Crosse County. There are 69 new positive cases in the county today. That's according to the Department of Health Services. 25 of those cases were people ages 10 to 29. That age range accounts for 64% of all cases in the county.
The statewide average for that age range is 33.3% of cases. The county is averaging 49 cases a day over the past week. That is the highest average for the county in a month. 20.6% of tests in the county over the past week have been positive.
La Crosse County healthcare experts say there is enough room right now to take care of people who need it, but they say the county is trending in the wrong direction and the health resources they have are not infinite.
And News 8 Now's Jordan Fremstead tells us how large gatherings like yesterday's rally in West Salem, which was estimated to be somewhere between 12 and 16,000 people, according to Bill Feehan of the La Crosse County Republican Party, that these kinds of large gatherings could cripple La Crosse's healthcare system.
This is trending in the wrong direction.
The average age of a COVID-19 patient in La Crosse County has gone from a person in their early 20s to a person in their early 40s. The older the person, the greater chance that person will have to go here.
This is not a drill. We are increasingly opening COVID units.
Hospital capacity in La Crosse County is okay for now. The new Cooley COVID-19 collaborative update shows that could change.
People with healthcare issues are having to go to the hospital because they are ill with COVID.
Tuesday, thousands gathered for President Donald Trump in West Salem, where there was little, if any, social distancing between people.
Usually it's minimally 5 days to up to 14 days later that we actually know what the true impact might be, if we ever truly know the full impact.
La Crosse County Health Director Jen Rumbalski says the county still can't keep up with contacting people who may have been exposed prior to that event.
Our health department team has had so many cases that we've only been able to reach 67.7%.
The message from the nation's commander-in-chief doesn't fall in line with the data.
We're rounding the curve, we're rounding the corner.
Viruses don't care why we get together, they care how we get together.
Tuesday's numbers for confirmed cases and deaths from COVID-19 are both the highest that we have seen throughout the entire pandemic so far.
Again, it's not the majority of people that are at risk of dying from COVID-19. Dr. Kevin Fitzgerald says data needs context for people to fully understand why this has their full attention.
Do the numbers. If we get up to a few thousand people with the virus and 10% of them are going to get ill to the point of hospitalization, our hospitals are going to get overrun.
Dr. Todd Kowalski, who specializes in infectious disease, says healthcare workers are already feeling burnt out.
These are our friends. These are our neighbors. These are people who are so incredibly committed to caring for you through all sorts of illnesses, and the strain is taking a toll.
And it's not just about COVID-19 patients.
We need to care for heart disease. We need to care for diabetes. We need to care for other medical issues.
If we don't change course, there will be issues.
Reporting in La Crosse County, Jordan Fremstead, News 8 Now.
And healthcare officials say people do need to prepare to cancel holiday gatherings. Even private gatherings can spread the virus. They say that is affecting the case growth rate right now in the county.